Hello, my name is Catherine Brace, and I did my project on trauma-focused cognitive behavioral therapy, which is quite a mouthful. It is goes by TF-CBT. So I'm gonna go ahead and start. Just a little bit of background in history. TFCBT is fairly new. It was founded in the 1980s by Dr. Anthony Manarino, Dr. Judith Cohen, and Dr. Esther Deblinger. So they are pictured on the right-hand side of the screen there. But they originally were looking for something to treat children who had been victims of sexual abuse, and they had found that there just wasn't much evidence-based resources to help children who have been affected by trauma. And so that was one of the main reasons that they started TFCBT. And something that I found interesting was two-thirds of American children will experience a trauma by the time that they are 16 years old, which sounds, at least I found that to be surprising. But when you think about violence, abuse, traffic accidents, bullying, deaths, you can get to that number quite quickly. Clearly, this is something that is needed, to have a resource that is effective for children who have experienced trauma. Some basic tenets, and I am going to briefly go over these because I'm going to cover them in greater detail throughout the presentation. It is phase-based and short-term. So usually it's going to be 12 to 18 sessions. However, that is going to depend on the trauma. So if a child has multiple traumas, or if just depending on the severity of the trauma, it can be up to 25. And then something that is a key tenet for TFCBT that is a little different compared to other um, resources or methods is that they are going to be very intentional about talking with the child about the trauma that has happened to them. And like I said, I'm going to discuss that further in greater detail, but that is a really key tenet of TFCBT. Family involvement is also really critical, or the caretakers, whoever is most involved with a child. And then the treatment is going to look different based on the child. Again, I'm going to address that later. Um, but also, this is comparable to CBT for adults, but with a focus on that trauma narration and processing. So, CBT being understanding how you think affects how you feel, which affects what you do. So, we'll address a little bit more of that later on. The counseling relationship. So, like I said, this is a form of cognitive behavioral therapy. So, that relationship is going to look pretty comparable to what it would look like normally, but with that trauma narration and processing. So, it's very collaborative in nature, not just with the therapist and the child, but also the caretakers as well. The therapist is going to be ideally, or needs to be, very warm, obviously, very empathetic, very kind and understanding, but also structured. There is a pretty laid out formula to follow for TFCBT. And then it's also important that the counselor is developmentally attuned because you're dealing with such a wide range of ages and stages. It's critical that the counselor is just aware. And then lastly is that the therapist really needs to be courageous in talking about what has happened, but also they need to be taking care of themselves as well, because obviously this is not easy work. Okay, so population served and empirical support. TFCBT is for children ages 3 to 18, which is clearly a wide range of children. But it's found to be effective for all ages. And then it's also been found to be effective for all different kinds of traumas, many different cultures and developmental levels as well. Currently, TFCBT is being practiced all over the world, which is incredible. Um, and then a couple of studies that have been done just to show the validity of this practice. A 2024 study was done with over 2,000 children that found over one third of, well, they compared children being treated with Tf-Cbt versus just routine clinical care, and we're trying to see if there was a difference. And so the patients that were treated with Tf-Cbt, there was a noticeable difference. One third of those patients had a noticeable difference in their symptoms versus those who just received clinical care. And then um, I'm going to jump down to the bottom one actually. So there was a study done with refugee children, um, and to see if TFCBT was effective for them. I think this is a really interesting study because of the depth of trauma for children that have that are refugees. So we're talking about significant violence, abuse, assault, kidnappings, gang violence, just really difficult, multiple traumas. And they found that it was extremely effective. So that was encouraging. And then also, it's been recognized by the Federal Substance Abuse and Mental Health Services Administration as a model program because of how well it's working. So all of those things have been extremely encouraging. The therapeutic process and goals. So these are the phases that I was talking about that I want to go into more detail. So the first thing is stabilizing the clinical symptoms. This is crucial. Before, excuse me, the therapist can do anything, it is getting that child into a stable place. So that's going to be goal number one. Then the next thing is working on skill development. So that is going to be, oftentimes these children are going to have anxiety or depression. So giving them skills that they can use in real time when symptoms are happening. So that's going to be relaxation techniques or breathing exercises, things that they can do to help calm their bodies down. And then lastly is sharing details of the experience. Like I said, this is crucial. The main thing is helping children understand distortions in their thinking. An example of that would be, this was my fault. That's a common one for children who have gone through abuse. And so talking through with them, helping them realize that they are not alone. They're not the only child that has been abused, that there are people around them to support them. And then also just, like I said, people used to believe that if you talked about the trauma, they would relive it. But they have found that that is going to live inside their bodies anyway. And so it's best to go ahead and process it. So that goes back to the CBT. How you think affects how you feel versus how you do. Because a lot of times children are going to act out after going through a trauma. So, um, like I said, it just really a crucial tenet to this is sharing the details of the experience. And then goals, we've addressed some of these, but dealing with negative thoughts and feelings and behaviors from the trauma. Helping children look at their trauma in a different way. So that's going to be the distorted thinking, like we talked about. Um, Externalizing their thoughts and feelings. So if we learn that if children can describe their feelings, they're a lot less likely to act them out. So just getting that out of their bodies as opposed to keeping it in. And then parent healing for child availability. Obviously, we want the parent to be healthy as healthy as they can. But one of the main things is the more stable they are, the more they're going to be able to be attuned and be there for their child. And then current neuroscience research. So there hasn't been done tons of research done just because this is a newer theory, but one that I found really interesting that actually one of the main founders was involved, is they looked at teenagers' brains who had 20 teenagers who had PTSD versus 20 teenagers who did not. So they did take MRIs of both groups before and after TFCBT. Before the TF-CBT, they found many differences. One of the main things that stood out was that there's no place that PTSD lives in the brain. It affects multiple parts of the brain. And so there was many differences in what the two brains looked like. Um, what they found was after the therapy, the children who did not have PTSD, their brains looked basically the same. The children that did have PTSD, they noticed a big difference in the areas of the brain related to thinking skills, attention, and executive functioning. Um, However, the biggest change was in the posterior cingulate, which has to do with memory. So that part of the brain actually got smaller, which is encouraging because typically that meant less ruminating on the trauma. Um, so even though that's a very small sample size, it's still very encouraging that TF-CBT has been shown not just to help with symptoms, but there are actual brain changes that are happening. And then lastly, this is my reference page. So I had 5 different resources that I used. There was a article that was done with one of the founders of TFCBT. So that was where I got a lot of my information. But like I said, I used all 5 of these to gather my information for this presentation. Thank you so much for listening. I hope that you found it as encouraging as I did.